I'm Chris Adams, the president of Engaged Public, and we are the folks who are developing Engaged Benefit Design. We have been delighted with our partnership in working here, and we're very optimistic that we might be able to provide a demonstration or a model that could be used in many other places.
There are a lot of healthcare services that aren't delivered as often as they ought to be, like good diabetes care, good asthma care, good prevention. And we also recognize that there are a lot of services that are delivered in healthcare that are delivered more often than they need to be. Because of those problems, we've developed Engaged Benefit Design, which is a way to use insurance benefits to help people become smarter, wiser consumers of healthcare. We were able to put together a list of services that really ought to be delivered 100% of the time to people. Good prevention, good screening, good chronic disease management, and prenatal care would be examples. And for those services, we're taking away cost sharing from the patients so that they don't have any financial barrier to come get those services. For services that are delivered more often than they need to, we've actually raised the copayment a little bit. Not to make it impossible to get those services, but to help people recognize that it's a good idea to learn about the pros and the cons of different treatments so that they choose the treatment that's best for them.
A third part of Engaged Benefit Design is shared decision making. Here's a diagram that will help explain. First, it's important to understand that for a lot of problems there is a decision to make. Once you understand this, you want to learn about the options that are available to you. And for each one of those options, you want to understand what the particular risks and benefits are. Once you understand all of this, it's very important to apply the lens of your own personal experience to the question. Your own goals and concerns and unique life circumstances will have a lot to do with what the risks and benefits look like for you as an individual. When you do this, those risks and benefits may look quite different. Once you understand the risks and benefits of various treatments as they apply to you, it's important to apply both your mind and your heart to the decision-making process. Your mind so that you consider all the relevant facts, and your heart to be sure that your own personal goals are accounted for in the decision-making process. Finally, you can make a decision, and the decision will be appropriate for you and the best one for your circumstances. Engaged Benefit Design provides patient decision aids. These are DVD booklet combinations that give you all the evidence about what options are available, what the risks and benefits are, and to help you decide what's important to you in the decision-making process.
My name is Tiffanie Hoover, and I am the nurse case manager in the Occupational Medicine Department, which houses the patient decision aids for the hospital. It's an unbiased video based on interviews of real physicians and providers and real patients so that you can relate to them. There's questions that they answer that most likely most patients will have. And this will provide a very informal, low-key setting for patients to get their healthcare questions answered without tying up a lot of the physician's time in the room.
Patient decision aids can be very valuable because a lot of times patients are hesitant to give their full concerns or questions. They don't want to appear ignorant or not understanding, and this is a way that they can have their questions answered in a much more private setting.
I think that you get better compliance with the treatment plan when the patients are better educated and they have more realistic expectations of what to expect from the treatment or the plan.
I found it very useful. I thought I knew what I wanted and what direction I wanted to go. And after watching the videos and doing the questionnaire, I had more questions.
It makes it it's not a one-sided visit anymore. Now you're there, like I said, you're a team with your provider. You know exactly what he's talking about. You know the steps he wants to take it in. You get to understand whatever you're dealing with a lot easier. And you can come in and you feel good about your next appointment.
Well, and at first, as a healthcare professional, it's like, I don't need to watch this. I know all this stuff. But you don't. There are always things you don't think about that doesn't cross your mind, a question you forgot, or like I say, I could have stayed on medication longer. And because my doctor knows me so well, we don't always communicate. Does that make sense?
Yeah.
So having the video helped me, and I'm sure him too, having questions like, well, what about this? Well, what about this? Did we try this avenue long enough? So it does. It gives you the tools to work with, aside from just, I know it all, because you don't. Even as a healthcare provider, you don't.
I really support patient decision aids, and I'm a true advocate of it. And the general approach to any medical field should be patient involvement with provider involvement as a partnership.
The best health care is reached mutually between a provider and the patient. And the best health care involves using the very best evidence that we have available to make that decision.
The engaged employee and the engaged patient is going to have more knowledge and be able to come up with better questions to help them in their process.
We really believe this is the future for healthcare, not only for San Luis Valley Regional Medical Center and all of us who are employees there, but for employees in our whole country. We think that by us working together better, we're going to have healthier employees, lower cost, and a better environment for everybody.